Hello, I'm Doctor Wonkyu Hong, dermatologist, key medical expert, speaker, and key opinion leader at HIRONIC. In Korea, I run human dermatology clinic, a leading dermatology network with 23 branches. In this video, I'll introduce the full-face lifting procedure with the new DOUBLO 2.0, the world's first micro-focused ultrasound and radiofrequency synergy system created by HIRONIC. Micro-focused ultrasound, or MFU, is non-invasive cosmetic procedure that utilizes focused ultrasound energy. The treatment involves emitting ultrasound waves that penetrate deep into skin, creating thermal coagulation points at targeted depths without affecting the surface. This process induces the body's natural collagen production, resulting in gradual skin lifting and wrinkle reduction. Radiofrequency, or RF, is a non-invasive cosmetic procedure that uses radiofrequency energy to hit the deeper layers of the skin, stimulating collagen production and improving skin elasticity. The radiofrequency energy penetrates the skin, generating heat that triggers body's natural collagen production process, leading to skin tightening and wrinkle reduction. MFU and RF are essential energy sources in aesthetic and are used for various treatments. The significant advantage and major strengths of new DOUBLO is that it allows us to utilize these two energy sources in one device. The SD, or synergy dotting handpieces, allows the use of micro-focused ultrasound and multipolar radiofrequency in one go by combining the ultra-fast consecutive emission of both energies is one shot. Clinical studies have shown that combining these two energies resulting in significantly better outcomes across more than 14 skin quality parameters, including skin elasticity, density, and even skin texture compared to MFU-only treatment. As a non-surgical treatment, new DOUBLO offers minimal downtime, natural-looking result, and is effective for treating areas such as face, neck, and various body parts. With 20 types of cartridges available, it allows for very precise targeting of treatment depths and patient-centered customization. There are no specific contraindications for new DOUBLO 2.0, except for some general limitations for the use of energy-based devices, such as pregnancy and lactation, open skin infections, stents, grafts, or electrical implants in the treatment area, among others. The precautions to be aware of include the patient's history of receiving lipolytic injection, loss of sensation or sensory impairment, atrophy, sclerotic, keloid, or surgical scars with the treatment area, and the known of suspected systemic or chronic disease. Any of these conditions may affect treatment efficiency and prevent achieving desired cosmetic result. New DOUBLO 2.0 allows for very precise targeting of treatment depths, helping to avoid damage to nerves and bony areas. However, during treatments, it's recommended to exclude areas where the major nerve, such as, for example, the masseter-mandibular nerve, temporal nerve, sciatic and ulnar nerves are located. Additionally, major bony areas such as condyles on the arms or crest in abdominal treatments, among others, should also be avoided. For the full list of contraindications and precautions, please consult the physician guide provided with the device. While deciding whether the patient is eligible for the treatment, in addition to contraindication and treatment history check, we need to consider aging type. There are single, sagger, and wrinkle types of the patient, which are defined by different skin thickness and different aging process. For example, if the patient bears thin skin and bony face structure, which is typical for single types, and there are signs of volume loss, we have to recover volume first before offering further treatment. Please note that for the best clinical outcome, we need to build a treatment plan based on the individual characteristics of each patient's skin. In the first step, We interview the patient, review their medical history, assess desired treatment results, and evaluate skin condition. A more in-depth analysis can be performed using a facial skin analysis machine. After considering all the factors, we decide on the treatment plan, including cartridge selection. The patient we are treating today is particularly interested in achieving enhancing skin tightening and lifting effect, which is exactly what the new DOUBLO 2.0 offers. We will perform a full-face lifting procedure. The basic protocol for each segment of the treatment area will include the application of the line-type FL handpiece as the first stage, and the application of the pen-type SD handpiece as the second stage. First, let's design the treatment area. First, we'll mark areas where important nerves are superficially located to avoid nerve damage. That would be transverse cervical lobe at the neck area, buccal and marginal mandibular branches of the facial lobe at the cheek and perioral area, and supratracheal and supraorbital lobe at the forehead area. We will then map out the treatment areas, avoiding sensitive zones we have already marked. We plan to treat cheek, under chin, neck, forehead, eye rim, and perioral areas, avoiding too deep treatments where lobe might be affected. We'll start treatment on the cheeks and on the chin areas to address the jawline and loss of elasticity. We will apply a sufficient amount of ultrasound care to pre-clean the skin. And as a first layer, we will use the FL handpiece with the A4.5 cartridge. This ensures that the energy will be focused at a depth of 4.5 mm, which corresponds to depth of a smart layer in this area. Pick up the handpiece, and the automatic recognition system will detect the active handpiece cartridge type and remaining shot count. Set up the treatment parameters by choosing the preset mode for the corresponding area. Smoothly move the handpiece along the treatment area in direction mentioned in the patient guide in 2 or 3 mm steps with the preset time interval. You can also adjust the interval to match your treatment pace for the comfortable operation. Do not be concerned about cartridge adjustment to the skin. The patent safety sensor will block the shot if there is no full adjustment, ensuring that there will be no accidental damage to the surrounding tissues. Since skin aging occurs across all layers of the skin, from the deepest facial layers to the epidermis, it's beneficial to stimulate overall regeneration throughout. We treated smart layer at the 4.5 mm depth. Now, we will address the fan layer at the 3 mm depth. To do this, we use FL Advanced 3 cartridge. The new DOUBLO 2.0 system is especially notable for its rapid treatment speed while allowing for visible and notable results. 4 handpieces enable us to set up the treatment beforehand without the speed to change cartridge during the procedure. We will now proceed with the SD or synergy dotting handpiece with the L1.5 cartridge. This cartridge is designed to treat the dermal layer with both MFU at a depth of 1.5 mm and RF applied simultaneously by ultra-short consecutive emission during each shot. Using SD handpiece, I focus on addressing nasolabial fold as well as fine lines around the forehead and eyes. As you can see on the setting screen, there are options to select the output of the radio frequency and the ultrasound. We can adjust the speed of the ultrasound as well, allowing us to customize the intensity of the treatment for each patient. We will gently move the handpiece in the circular and linear motions to cover the entire treatment area. During the SD treatment, the patient will feel slight tingling sensation from the ultrasound treating the dermis, as well as warmth from radiofrequency. Although it may look like a simple procedure, it actually combines 2 treatments. We finish by wiping away any remaining gel. After treatment, patient may experience initial light redness and in some cases slight swelling, but these symptoms usually subside quickly. We advise patients on general post-treatment precautions, including avoiding heavy sports as well as activities that may cause excessive heating of the skin, like sauna among others, for up to 3 days. To summarize, today we have performed two-step treatment for our patient. We have started with the FR Handpiece 4.5 and 3.0 cartridge, treating smells and fan layers. Next, we proceed with the SD Handpiece and 1.5 cartridge. Essentially, we've treated every layer of the skin using new DOUBLO 2.0 system, ensuring comprehensive skin rejuvenation.